I'm Caroline, lead researcher on this review. So this review has highlighted the broad range of interventions and activities at community level that have been studied and which may support mental health of older adults at times of heightened risk. We've grouped the approaches studied and written about according to the form they take, for example, group-based, mentoring, use of technologies, but we're also considered function. What kinds of stressor are they trying to address or mediate? Might that be loneliness, retirement, financial stress? It's clear that the combination of form and function is complex. What is also clear is that the mechanism, what is it in the intervention that actually makes a difference to participants, is perhaps as, if not more important, simply than does it work. Some of the potential mechanisms common to a number of interventions were making connections between residents and getting involved in creative activities, often using locally available places and spaces. Although separate from the review, the COVID Life project, led by our partners, the McPinn Foundation, really brings to life why creativity and creative activities might be adopted by interventions aiming to make connections between people as a step towards supporting people's mental health. Here's Gillian talking about the project, followed by Michael, one of the people who got involved.
My name is Gillian Samuel. I am a peer researcher on the public involvement team working at the McPinn Foundation on the Public Mental Health Programme of the NIHR School for Public Health Research. My role is to bring the voice of the public to public mental health research and to ensure that what I do on the programme is timely, relevant and meaningful to people's lived experiences of mental health. We found ourselves in the unique position of working on public mental health during a public health crisis. We felt it was important to recognise and respond to this. We created COVID Life to document our experience of these times and reflect on what all of this means from a lived experience perspective. We used creativity as a tool to do so. We then set out to engage the public to do the same, asking the question, what happens to our mental health during a public health crisis? The response has been overwhelming, with many entries now on iampublicmentalhealth.org. Please describe how you got involved in COVID Life.
Well, I knew nothing about COVID Life, but Gillian posted something saying, looking for artwork that had been produced during COVID. I had produced a number of sculptures, so I just responded to Gillian and it started from there. Well, I started sculpting about 7 years ago. I had two major operations in a week for cancer, and this left me, and it was traumatic, and so I turned to just doing some odd things with my hands, and that started feeling a little bit therapeutic and sort of a mindful sort of process was that helping my state of mind. So we had 7 years later, we entered lockdown with COVID. This was an opportunity because one had a lot more time available, and it's a question of how you fill the time. So obviously sculpting was a way. I do a rainbow sculpture and put it on the front wall of our garden, with a message of hope. So this started to attract neighbours and passers-by, and they'd comment on it, and that was good, and it started involving the local community. That was quite fun, and started to involve our neighbours and passers-by, particularly children, because every time I went out, the hands on the sculpture had moved round, and there was an involvement there. Neighbours and people that I hadn't talked to before, started chatting, and there started to be a bit of a community spirit, seeing what was going on in the front garden. So the whole thing has been, it's been very good for me and given me lots of projects and stuff to do, which is very important during lockdown, having a focus. What was great, the local community, neighbours, passers-by, strangers who I'd never met, just started talking. There has been a whole neighbourhood element to it. The local community have been getting something out of my front garden.